Good afternoon.
Okay.
How are you? I'm very happy to introduce Paul Meiser. Paul Meiser, Montefiore, is the Director of Research Program Development at Montefiore. Paul, how long, said you were doing it a long time.
I've been doing this a long time. I've been doing it since 1990. Oh, sorry.
So, so why don't I let you
I can take this away. Thanks very much. Thanks for inviting me here. My name's Paul Meiser. I've been working at Montefiore since 1990, and I think kind of my career trajectory has been. When we first started, I was the planner for what was called the Ambulatory Care Network, and that was our series of community health centers. And what we were doing is we were developing new community health centers, and so I wrote grants for our Section 330 grant, which allows us to provide healthcare services to people irrespective of their abilities to pay, and I worked on facility design and kind of how when you walk into a health center, you walk into the waiting room and you walk into the front desk and what they needed on the front desk, and then as you walk back into the clinical area, where should the administrator sit and how should the exam rooms be laid out and who should be next to whom, and because so much of what we do is really kind of dependent on how we're organized, right? And so I got a lot of experience in doing that. At the same time, I spent a lot of time writing grants and trying to develop programs. And at the same time, this was in 1990, and as you can imagine, HIV was happening and there was money in HIV, and so I spent a lot of time writing HIV grants. And over time, I have become the program director for our Cicero program, which operates in 10 health centers and is our HIV program that we just run in the 10 health centers. And so we've been doing that since before antiviral treatment, right? And so it was kind of palliative care-like early on, and it was very psychosocial. And then it became very treatment-oriented, and the treatment was complex, and the drugs were dangerous, and people had to know how to mix cocktails, and so it was kind of specialist-oriented. And as you guys know now, today, it is much more chronic disease-oriented, right? And we now just have embedded it. But we've always, one of the things that we've done is we've always done it within the community health center model, because in the community health center, it's not like when you walk into the AIDS centers and the AIDS dedicated places. In those places, it's cheers. Everybody knows why you're there, right? And who your friends are, and everybody knows why they're there. When you come into the health center, people really are able to do this in an anonymous way, right? They sit in the waiting room with a snotty-nosed kid, and they sit with a little old lady, and they sit with a pregnant woman, and nobody knows why they're there. And so once they go back, they get the care. And we've really achieved great results in that. We have about 1,000 people in care. 90% of them have undetectable viral loads. And as I was telling Abigail, we're now embarking on what I would call an intensification program. So what did we do with that last 10%? And we've been flatlined at that last 10% for 5-6 years, right? It goes 86%, 91, but in that little range right there. And so we're now going to try to focus on that last 15%. It's really about 15%, not, even when we say 90, it's about 15%, because there are people that bop in and out, right? They kind of, and we've done a lot of good things for them. So, we need now to focus on them, and so we're going to do an intensification program, because really my feeling is that we were always making them come to us, and now we have to rethink that, and we have to go to them. And so whether we do it in their homes or whether we adopt technology, there are things where you can put your iPhone up to your mouth and it can observe the Adam's apple, and then it sends a picture, and then a research assistant can take a look at the picture and see that you ingested the medication. And just imagine, it's really directly observed treatment, right? Like they would do in TB or in methadone. Well, we've been doing this now for active drug users for their hepatitis C medication in the Bronx and 8 sites around the country. So, we can learn how to do this. So that's kind of the background of who I am, where I come from. And in the last few years now, I've been doing research program development, which really, its purpose was to embed research into programming. And we do a lot of quality improvement, and we could think about some hypotheses in those and look at and do some analysis. And we might want to collect a few more data elements when we do our intake forms. And it's just a little bit of a switch, but it's a major mind switch for people. And the people in programming think that if you do research, you're going to slow them down. So I spend a lot of time trying to convince people that they're doing research and showing them that they're doing research. And since you guys are implementation scientists, you guys know that when you do a pilot study and you spread it, that in implementation language is called a step wedge design, right? So I keep having to educate them that they are actually, implementing research strategies. They just don't know it. So I know that you guys have here, this is about mental health methods. So what I'm going to present to you is my framework for planning, implementing, and sustaining sustainable change. And what I would like you guys to do, and I know that you guys are interested in innovation, right? So these two things need to go together in some format. So as I'm presenting this, I want you guys to just take some notes about things that pop into your head. Oh, this would be applicable to whatever that turns out to be for you. And just kind of scribble them down. And at the end of the presentation, I have a little exercise that I'd like us to try to do. And we can do this together. And we'll just take whatever your notes are and whatever your thinking is and try to apply it and see how it would work for you. So, let's see that. Yeah, so this is what I'm going to do. And I'm going to pretty much breeze through this. I'm not going to spend, you guys will see it. It's a very intuitive kind of concept here, right? I'm going to describe it. I'm going to tell you a little bit how to use it. And then we're going to have a discussion about how you could think about it for mental health programming. What I want to say about ladders is that this concept came into my brain when I was driving to a meeting with a colleague. I was like on the road, and I was driving to a meeting, and the ladder part, L-A-D-D-E-R, came into my brain. It just kind of came, I don't know, it just, I recognized that some idea was coming into my brain. And so I was very excited, and I had to go tell her about my idea. And she said, oh, that's great, that makes total sense, but you need to add the S piece to it. So we have ladders. So let me tell you about ladders. The first thing about when you want to do organizational change, basically you have to embed it in organizational DNA, right? And you can think about organizations as complex adaptive systems, right? And we can actually look up a lot of literature about that kind of stuff. So that the first concept really is that for organizational change to happen, it needs to be embedded into an organization's DNA. So I'm going to show you the letters of ladders, and I'm already start out with one kind of conflict here. I'm talking to you about DNA, and then and you can think about DNA, but then ladders in and of itself is a very linear thing in your mind, right? So we got to keep those two things in mind. If I was a better graphic artist, and maybe there's some way of depicting that. So let me just go through. Here's the DNA. The first letter, the L is leadership. Alignment. See, this is my being graphically impaired here, but data, demonstration, evaluation, replication, and sustainability. And all of this is a mix. And one of the ways I started trying to depict this is if you could just see these letters moving around. But if I did that for you on the screen, you would be nauseous. So, I try to not do that for you. It's ladders, when I tell people this, I get it. Yes, that makes sense. The researchers would call this face validity. Yes, it makes sense. Those are the elements of sustainable change and of transformational change. Yes, I can see that those are involved. And it's similar to other frameworks that are out there. There's transformational change, on the collective impact models done by institutes like the Tamarack Institute. And there's a lot of stuff along these lines. If you read the kind of the gray literature reports, you know, when organizations are reporting on what they're doing, you can kind of just see that they organize a lot of the reports with these elements, right? I just think that what I've done, as I said, you know, it just kind of coalesced in my brain, and to be able to present it. You know, so these transformational changes, they have practice system leadership, embrace a framework as qualities. They have assess community readiness, focus on data and measurement, communicate and engage, ask what's next as one framework. Or, you know, UCLA had a health system innovations life cycle that talked about defining the opportunity, design the intervention, charter the innovation, pilot it, deploy it at scale, evaluate and exchange learning. Then there's Russ Glasgow and others have his PRISM kind of thinking, which is the practical, robust implementation sustainability model, and these kind of exist, and these are conceptual frameworks that are out there, and there's even, you know, the rapid realist methodology, right? So all of these sort of exist, and I think what we do here is just kind of bring them together and lay them out in a way that is easy to remember. And I actually talked a lot to Russ about, you know, his re-aim kind of stuff. And what Russ said, yeah, it just worked out that way, you know. And so I just, you know, he didn't want to put it out that way, but people remember it, and it works out that way. And I think this is very similar. So what I'm going to do now is I'm going to try to pretty much breeze through my conceptualization of the literature and of what these different dimensions of it have, because there's a lot of literature out there, and I'm by no means here to summarize the literature. I just want to kind of show it to you how I think it weaves together and what goes on here. So the first one is leadership, and you know that when you look at a lot of change literature, the vast majority of it talks about leadership, right? And there's tons of literature out there, and article after article about it, and different like takes on it. But these are the things that are generally in there. You know, the leaders have to provide a vision. They have to buy in both to the change idea, whatever concept that is, and to the process. They have to be responsible for the facilitation of the process. They have to set some parameters of accountability, and they have to communicate. I didn't know that was going to be. And there are key principles, you know, and these, again, this comes from clear direction and change readiness, and all these things need to happen as part of what leaders are doing, and they are really fundamentally champions of the ideas, right? And they also have to have some way, and this is this facilitation and communication of what we would, you know, call community engagement, right? And how to work with people on what their ideas are. There are so obviously, you know, a lot of cultural kind of things and how the organizational culture that they have to bridge and understand. And they have to make sure that there's some kind of structural framework that supports the transformation. And most importantly, they really have to be the communicators. You know, I found a really interesting slide that looks at why do projects fail. And what you see here is communication, right? And you can have a great project, but if it's not communicated, you know, it's terrible. So that's leadership. The next one is alignment, and alignment is interesting because also there are different ways to think about, you know, from a theoretical perspective. There are the viable systems models kind of things, or the Stanford Beer has this way of diagnosing the system for organizations, right? And the concepts of organizations. And I think that there was one concept in there that resonated with me from a theoretical kind of perspective. This, I hope I can pronounce it right, recursivity, right? That there are a bunch of these different levels. And the way that they describe it when I've been reading about it are like those Russian dolls that one's embedded in another, right? And so really, when you think about alignment, there are these different levels. And the way I conceptualize it, you can think about it as a strategic alignment. Then, what's the institutional strategic alignment? What's the operating organization? What's the facility? And what's the program? So I was describing to you my Cicero program, right? But we work within the Montefiore Medical Group, and the Montefiore Medical Group has health centers within it, and then into the medical group, and then within the Montefiore structures, right? So you can think of it also in the service delivery perspective. So you have there's both strategy going and service delivery, and I think one of the most for me the concept here is that as an implementation scientist, what it really means is that you have to have some constant monitoring on, because you have to pay attention to circumstances. And I've been very aware of contextual things, right? And context changes. And so when you're in a meeting, you'll hear people talk often about alignment, and there are adjustments. And I think that that's one of the things that we need to pay attention to, is how things adjust and how things are aligned, and paying attention to that is an important piece. Well, the next one is something that you guys all know about because you're in School of Public Health and you deal with this. This is data, and you know about what is measured is done. And I write this down as, this is alignment, demonstration, evaluation, replication. They're all considerations. The questions that we ask, you guys are really more expert than that in asking those questions than even I am, right? What to measure, how to measure, when to measure, who will measure. Those are the questions, but it's the questions I now ask when I try to do the embedding research into programming, right? Because these are the kind of questions that people need to pay attention to if you're going to be successful in having that partnership between research and programming. Because you need to understand how it will be used, who will use it, and how it should be presented, right? And we have all these quality improvement kind of frameworks that we use nowadays, right? And PDSA cycles, and then we think a lot about how we would want to display data and what we want to do with it, how we're going to do it, how to analyze it. And it gets pretty complex. And one of the things that we do understand, though, is that it's a huge issue. And I'm going to show you another slide coming right after that. But it's a huge issue, and we spend a lot of time on it. But it's not the only issue, right? We were presenting these other ones. And I think that that's part of the takeaway I want for you guys. It's that there are these 7 elements. And you can't just focus on this one or any one of them, but they're all sort of combined. And this is where graphically it'd be nice to have this thing twisting around and the letters kind of colliding. And I had a kind of a rung thing where it went up and down and up and down, and but really, again, you guys would be nauseous if you saw that. Let me show you this. This is my conceptualization of an improvement pyramid. And I get asked about it a lot, and why I have like this. So in my HIV program, when we stopped getting data on STD tests, we went down to 0 on STDs because we were not getting the data, right? So we can only report that we were 0. The minute we got the data, we got to 57%, right? And then when our guys did a QI project, it got to, 73%. So this is what I think of as the data, right? And this is where you get the data. And in data, this is reporting. We use data for reporting. And in the clinical world, we use it for quality improvement and for work lists, right? And so that's why data is so important, right? And then, of course, that the first argument that you get when you want to do a quality improvement project is that data's no good, right? So we got to get past that. So we spend a lot of time cleaning data and fixing up data systems. The next part about this, and this is 60% 2020, 60% 30-10. You can think about whatever works for you, right? I was telling you that in my program we're at 90%, right, of undetectable viral load. So for me, that intensification is 10%. But systems, right? So somebody, you have workflows in your facility, right? And how things work, and that's, you could think about, and that's what that systems thinks about. And then the last 10% is always, there's something that happens, there's an individual, they don't fit into any broad category, you can't group them, you gotta really look at their individual needs. And so that's what it is, and the services can either be individualized or intensified. You can talk about it, however, whatever fits in your conceptualization. Oh, and this sort of, in my mind, this corresponds to Deming, right? The 80-20 rule, right? I mean, so again, if you thought about this being 80 and that being 20, it's pretty close. And I do have some data to validate the 60-20, kind of stuff.
Can I
yes.
just so having 90% of your caseload, HIV caseload be sort of undetectable?
Yeah.
So given what we know about the cascade, that's pretty remarkable.
Right. We're doing it, right? We're 90-90-90. Right? We're doing, all the people that we have, of the people we have in care, 90% have undetectable viral loads. And we miss out some people, but I think that there is an urban phenomenon here, especially, right, where people can go to all sorts of different places to get their care, right? If you did this in other places, it's not quite the same, right? I mean, we are in the epicenter of HIV here, in both in the epidemiology of it, but also in setting up care systems, right? I mean,
Cascade 2 usually is broader than any particular facility, right? It's like a population level health visualization. So these are just all the folks that wind up going through the door at Paul Center, right? Whereas the Cascade's measuring all the people who don't go through the door. And so all the people who are undiagnosed or who are never linked to care, who aren't on medication. And so this is a very high percentage, but in the broader population level denominator, this is just
Even within a hospital, so 99-90 is.
I mean, the people I work with in the Hudson Valley are also between 85 and 90% on suppressed viral load, so in a sustained way. I mean, it is pretty, of those who are in care, it has been a major feat for the field. I mean, for this particular field.
Right. And that's really why I go back to this intensification, right? Because whatever we're doing here and here is getting us to 90%, right? And so now we got to figure out the other piece. So here, this is the next D is demonstration, and this is do it. And this is what operational people spend all their time doing. I think that the important piece here is that there have some visible actions. We use these learning frameworks out of quality improvement, like the PDSA cycles. Again, this from a change management perspective, it's close monitoring, right? Paying attention here, and contextual learning and adaptive learning. And these PDSA cycles really give you an opportunity to capture that, especially if you can get somebody to keep process notes. And Abigail and I were talking because I was just downloading to her all the stuff that I've been doing and realizing that I needed to keep process notes. It's not an easy thing to do because it's something that is extra time, right? But it's very valuable if you can spend time doing it. And people, in programming, they get the demonstration part. That's not hard to focus them on. The E is for evaluation, and this is reviewing results. Did it produce what was expected? And you can imagine how this goes back up to that leadership function, right? And same thing with data. They all go back, they go all back and forth. I encourage people to think about the evaluation in a multi-dimensional perspective, right? And if you look operationally, most people are going to look at cost. They might look at some of the outcomes. I think there are more important outcomes, though, that need to be included, and these are on quality as well as kind of the consumer experience. And so, this is the triple aim or the quadruple aim if you want to include equity in there. And this also kind of gives an opportunity when you're doing this to add a little bit of the researcher perspective in here, right? Where you test things out, you probe, you do simulations, you try to identify issues, you want to point out what the biases are, and you can go back and rerun analysis. And this is really an opportunity for the researchers to really be helpful to the program people here in this dimension right here. And the researchers don't get it, and neither do the program people, right? Because the researchers are never at the table understanding what the guys want. The program people just going to say that the researchers are going to slow us down here. But I think that, if you bring people together at the right time and they're going in parallel, you really can make this happen. The next piece is replication. So this is when you do it again, right? In IHI, this is spread, right? This is what they call the spread, right? And when you do the replication, it's an opportunity to change the goal, to think about if you wanted to do anything differently. Did it succeed? And could you make the execution time more compact? And this happens all the time, right? Because, when we do a program the first time, we recognize that we sometimes collect a lot of extraneous data that we never use for any analytic purpose. So we can bag that, right? And we can just say, and you can start with the process, because really what you do is you have your evaluation and you have your data that you can then show people what it's producing. And so you can say, this process produces this. So you don't have to go through all of those steps, right? When you're going to replicate it, again, the context is important. You're going back up to the alignment, to the all of the different steps, right? Because you have these adaptive systems. There could have been external or internal situations that changed. We had a project that I was working with the Director General Pediatrics at Montefiore, and we wanted to embed these new pediatric programming into what the medical group did, and he was just the general pediatrician and the head of the division. Well, right when we finished the project, he got named medical director at Montefiore. You think we had a chance to put this into the QI laundry list? He didn't, the next day it was there. Like, we didn't have to tell him anything. So these things happen. And this is also one of the opportunities to think about other successful case stories and learning. And this is one of those things also when you go to Russ Glasgow's re-aim kind of stuff. Very kind of, this is the maintenance phase, right, of what he would be talking about. The last one is sustainability. Again, sustainability, when I do programming, sustainability is what I'm aiming at, right? I'm trying to do everything that's going to make things sustainable. Sometimes I recognize we jag off in one direction or another, but we're trying to go in that direction, and it's a leadership function, sustainability, and that's really what the leaders need to be paying a lot of attention to. Really what you'd like to do is you'd like to make it, whatever you're trying to sustain, the default option, right? You want to make it the right thing, you want to make it an easy thing to do. And perhaps most importantly, what happens here, you try to hardwire measurement into the activities across the organization. And so when I'm doing these data kind of things, I'm trying to do it so that the system is collecting the data, not the researchers, right? If the researchers collect the data, that's going to be the expectations. If the system collects the data, it'll get done. So let me review. So I think my concept often with these kind of things, it's almost as important to say what ladders is and what it isn't, right? So it's not a theory, but if you wanted to kind of look at some kind of theories, maybe you would talk about the normalization process theory, right? But it is a framework, and really ladders is intended to be applied. Normalization process would have this stuff around coherence, cognitive participation, collective action, and reflexive monitoring, right? And it pretty, having heard me, you would say, yeah, it kind of has that in there, right? So I think it's sort of consistent, but it's really an operational idea. So what I wanted to do with you guys have been taking a few notes. I wanted to use ladders or point out that I think that you can use ladders across the different time frames. And so this is why I think it's dynamic, right? And different time frames where you're doing a project. So you'd have the exploration kind of component of a project, right? And this is where you'd be doing kind of your needs assessments or kind of figuring out what the lay of the land is. And then again, you'd have the installation kind of where you start out, right? This is what we're talking about, the demonstration where you're designing and planning a project. Then you have your full implementation. This is when you're really doing it. The initial implementation and the full implementation. And I think then also you have the next step would be your evaluation step. And so I think the ladders really lends itself to being used as a leadership tool. And remember how we were talking under the alignment that you have these different levels, this recursivity, all this stuff. I think it can be used at all different levels for all different kind of people who are involved in that. So I wanted you guys to look at your little projects, whatever is popping into your mind, and I wanted to try to test out if we can use this in a little framework. And we have a little handout. You guys got it?
We have. Yeah.
Oh, you got them.
Yeah.
Great. So this is my way of thinking about it. The way it operationalizes is with some kind of objective statement. So when you guys have your little list of projects, what do you want to accomplish there? And so let me give you some examples of an objective statement. And then what I suggest is you kind of think a little bit about what's your assessment of this and what's your plan, right? So an objective statement in my conceptualization, so, maybe how do you create an operational structure to maximize behavioral health staff productivity? Or we wanted to sustain 2 staff members after grant funding expires, right? So this is the key piece to this, as grant writers, and if you want to do some of these things, you write specific aims, right? And we spend time writing specific aims. So, if you guys could take a couple minutes just to write down on your piece of paper what you think an objective statement and what your assessment and plan would be. And sometimes the assessment, so, leadership, you might say, is totally on board. And so your plan is, you don't need a plan, right? Or you might say, I have to go talk to the vice president so that we can go get him convinced that he needs to do this, right? And so you can think about how that might work. And sometimes what I think of this is a really nice way to do process notes, and I'm really not that good at doing process notes. I'm actually a terrible note taker. But when you do it like this, you could get a notebook that you could just flip through, right? And this could reflect the different time periods of where you are in your project and as you're moving your way through. So I'm going to give you a couple minutes just to think about it. You can also ask questions.
I wonder if it might be helpful to walk through a specific example. I'm not sure some of our guests that are not with the center have ideas that they want to use, or I have an idea we might be able to use.
Yeah, I was going to suggest exactly that.
Oh, okay.
So I'm just waiting for, give you a couple minutes to write down whatever was coming to your mind, and maybe then we can just do that.
Okay, great.
Yeah. Are we ready? Yeah?
I was thinking it might make sense to use an example of a project that we're working on. Abigail and Allison are working on a little bit on the program side and the evaluation side for one of the Thrive NYC initiatives, and Montefiore is part of it, I believe, as well. Is that right? Yeah. So the goal is for the Thrive initiative, this particular initiative within this whole set of large initiatives, is to increase prenatal and postpartum depression screening for women to universal, which means every woman who goes to any provider gets at least one prenatal depression screening and one postpartum depression screening. And then as you move that forward, of course, you want any positive depression screens to result in a referral to appropriate treatment, and then ideally down the road, you're looking at reduced depression in both of those groups. So that would be an objective statement, increase prenatal and postpartum depression screening to universal across the city.
Perfect. Exactly. Perfect. Right?
You two can do the rest.
Okay, yeah.
I'm just messing with you.
So in terms of using this tool, so the idea would be to think about for, say, the whole initiative or Montefiore in particular, how sort of what are the existing almost like assets in a sense or resources within each of these categories, and then how you would, if you see a gap or if you need to figure out how to leverage what you have, then you would develop sort of your action steps on the plan column.
Exactly. Yep. So you would assess this like, is the leadership on board, right? And you might want to assess all the different levels of leadership, right? So you might say the project leadership is there, right? And then you might want to say, are they all aligned? Do they have the same understanding, right? And you might keep going, and you might discover that at one of the places that you're working with, that they're not, the leadership isn't quite on board, and so then your plan would say something about how you would address that, right? And so, and then you would do the alignment, right? And you would look at your internal priorities and your external elements, right, that are happening. Then you might think about, so now when you describe this, you're kind of describing what data needs to be collected, right? And you kind of have data systems, and so sometimes you need to have a data collection plan, right? And your assessment is plan needs to be developed, data collection plan needs to be developed. So it's a simple thing, to move it into the other column.
So then thinking about the way that all of the elements of this framework work together, the leadership, for example, it could be that the assessment is that the leaders are all on the same page regarding the importance of achieving the outcome, but they're not aligned related to how to do that, and then they may not be aligned related to how the data should be collected and the extent of the data. Because I know what we find for this project and for many others, everyone wants the universal screening, or everyone wants 100% treatment, or whatever the goal is, but then there's often a lot of, I would say, misalignment in how you go about it, and then as you mentioned, the data part. Some people seem like allergic to data, so the program folks don't want to do the data part, or there's a lot of confusion about how to get to that end goal. Can you talk about that a little bit?
Absolutely. I mean, so this is the alignment. You would then focus on the alignment, right? And try and come up with strategies. So your plan would lay out a few strategies, right? And as you can imagine, I think of this as a program reporting tool. So you could, this is your ability to use this almost in a PDSA-like cycle, right? You could just keep doing this. This didn't work, this worked, this didn't work, and you start learning it, and you're collecting this, right? I mean, that's the nice piece about it, that you're by using this framework, and then you could share this framework with others, right? And so you could tell people, this is how we're going to do it. And so one of the things that you might say is that we're going to, these people are not aligned. Now we're going to go to them, we're going to show them this framework, and we're going to ask them how they feel they can align. Right, and until you get there, right? And the one thing I will say about a lot of these kind of programming, so people will do things in different ways, and that's an opportunity to learn, right? And so what we need to do then, as kind of the researchy side, is figure out how to collect that, right? And then at the end we want to share it, because this is when you evaluate things, then you have an opportunity to replicate it. This is how these guys did this. And so, we spend a lot of time in learning collaboratives, right? And in learning collaboratives, we do these things, right? Where how do you do? You guys are doing really well. You got to 92%. What are you doing? Tell us, right? Oh, and so then you ask the other guys, well, do you think you could do that? Or how would you do that? And so you move, right? So you can move your way right through this. And it's all, and again, it's kind of a clever way of using a tool that people intuitively understand. And, right? I mean, that's kind of how I look at this. And I think, you would ask questions around the data. Like I said, it's going to take a long time, and you might be stuck there. But what I like to point out to people is that if you're stuck here, it doesn't mean you can't go on to some of these other steps, right? And especially the sustainability stuff, right? And you're coming up with criteria. You're understanding this stuff in different ways. So this was my question. I think we're doing it, right? Can we apply?
Yeah.
Yeah, go ahead.
Yeah, I just had a question. Could this also apply to just one part of the program process? Basically, I can envision a ladder process within a ladder just to basically get leadership on board. For instance, you would first identify, like, okay, who was on board, who was not, who within my organization would be able to help me with my goal to convince them, find alignment, what remarks or incentives have worked, that would be the data. Demonstration, where do we approve that this has worked potentially, then evaluate, like, okay, we would do a power analysis to see who can we move and do what, and then if that does work, we can replicate that and then eventually integrate it into the structure. And that's just with pursuit of leadership.
So that would go back to how you specify that objective statement,
Yes.
right?
So basically,
It's
it
up
applies
to
to
you.
all different sizes. It can be large in scope or very small in scope. That's what I'm asking.
All up to you in specifying that. And that usually turns out to be the hardest thing, right? When I do consultations with people, we spend an extraordinary amount of time on trying to hone in on what people are doing. And what I tell people is that you have a lot of great ideas. And in meeting speak, what I tell them is that you could put those other ideas in the parking lot. Let's focus on one. And because I think that's the power of this. Once you make your way through this, you kind of get it. And so when I sit there in my job, this is how I think about things. This is how I hear, right? I hear people talking about leadership. And if you now pay attention, right, you'll hear people talk about alignment all the time. And if you pay attention, you just know that these are all data dialogues, right? And then these are just the elements. And what makes this nice, it's easy to remember. And if you remember that it's not static, that's the most important. That's a dynamic framework, that it's going back and forth, jiggling all around, right? You can just use it. And it just works. This works for me. So I don't know. Maybe we can get it to work for you. Yeah.
I wonder to what extent it is filled out alone versus in a team-based setting, because it seems that different people, so much of this is sort of context dependent, and where you sit in an organization could very much determine your impressions, what you would fill out. So how have you sort of applied it as a tool you work with versus your group?
Well, so yes, I mean, and I think those are both options, right? Especially if you did it in a group setting, you could just ask a group to do this kind of stuff, right? Or I could ask you as an individual to do it and then talk about it as a group and see if you get some group consensus on it, right? But again, there are these different perspectives to it. And I think that's the power of this, in that it allows you to collect those perspectives, right? And that's what I like about it the best.
Yeah, I mean, following up, I think it's interesting. I think it could be really provocative. It could provoke some really helpful discussion around issues where maybe it's hard to actually get under the surface to figure out like what's going on, what the issues are, and how to plan. And the way that you're talking about it as a dynamic tool seems really nice in that way. I wonder if there is a way to visualize like how you use tool, because this, when it winds up on paper, then it becomes, more two-dimensional. I wonder how, and as you said, the DNA wishing it had some more movement to it. I wonder if it was a way.
So I describe this kind of as a notebook of stuff, right?
Yeah, I think that's neat.
And that's it. And so one of your things is, oh, I need to go and look back at it, or I need to edit it a little bit, right?
Yeah.
These things have changed, and so you keep just updating it, right? And that's where it gives you those process notes. And you know, what I think is that people understand it, right? It wasn't hard to explain. You guys, you kind of got it pretty quickly, right? What it is. So it's then kind of using it and building up the notebook.
Do you have, so for way of use, do you have strategies that have proven effective? Thinking specifically around leadership and alignment, right? Because when introducing a new program, probably the process, sometimes leadership can be not as forthcoming as you might want them to be. And sometimes the questions about alignment come later,
Right.
right? So do you have any strategies that have worked for you as you've been rolling things out and thought about this in terms of how to get that out sooner and better?
Right. Well, one of the nice things is that this makes you recognize you need to do that, right? So I spend, when I start developing programs, I try to get the leadership on board, and I try to go and I talk to them. What is it that you want out of this, so that I am doing something that they want, right? And so we align. So I'm getting them on board, and we're aligning them, and I'm aligning the programming with their priorities. So we start out that way, right? And I'm thinking of this, and so I'm listening for this. And then the other thing I always do with them is I always give them feedback, or you know, make these clarifying statements. So is it? Let me just check to make sure that I understand what you're saying. Kind of comments, right? Make sure that we're all on the same page and we have the same understanding. And the alignment stuff. The alignment is probably the most dynamic thing. It's always changing. And you basically have to just take it as such, you know, be able to record it. And sometimes there are things that radically change what you can do, and not like I was, you know, saying with my colleague becoming the medical director. It was over with. We didn't have to sell it to anybody, right? Boom. That is a major realignment that facilitated. The same thing could have happened. He could have left, and somebody would have come in, and they might have taken 6 months, 9 months, a year to get somebody in, and the whole thing would have just bogged down, right? So, yeah. I think it works, and it's just, for me, it's just a simple way of doing it. So I got a question for you. Do you think you guys could give this lecture? Could you give the talk? Could you convince somebody to use ladders?
Well, I was looking at the evaluation questions,
That's
and
what I'm asking.
yeah, so what I said was I would feel comfortable making the presentation because it does feel very intuitive, but I don't think that I would feel credible making it until I had really used it. So I would want to go back, like maybe like Abigail and I could sit and really like flesh it out and think it through, and then I honestly think I would feel comfortable presenting it.
That's great. Yeah.
And that was Allison's point, going through it once.
Yeah.
So intellectually, conceptually, you know, on your own language, it has space validity. Actually walking through the steps and
Because I'm happy to do consultations with you. Because you know, this is this is the spread phase of ladders.
so I you know, Paul and I talked about the project I'm doing in Brazil, and that maybe doubling back on a couple of these for sure.
Yeah. Oh, good. See you.
Thanks very much, everyone.
Right. So I don't know what was going through your mind.
What's going through my mind is that this is easily and immediately applicable to a lot of things I'm involved in right now that I cannot speak to in this room. So
Yeah.
it's very clarifying.
Oh, okay. Good. And the gentleman behind you, so this resonates with you?
Oh, yes.
Yeah.
I think that what I wanted to first understand was from what you described in terms of like the Russian doll setting, that made me think not just of dimensions and overlay, yet also size. So I wanted to say, could this be scaled up, or was this more of a macro thing? But it seems as though that it can be any size that you want. So I could basically see constructing a whole huge ladder, a ladder to the or stairway to heaven, so to speak. And that can be made up of small miniature ladders that get you there bit by bit. Basically, that you could break down the ladders as to one large ladder, but then even every part of that ladder could be its own little ladder. That basically there could be a gradient and gradual steps that lead up to this much bigger picture. And I also wanted to know, to what extent are you able to apply this with the context for outside of the organization? Because I could definitely envision how the community centers to respond to treatment for HIV and AIDS patients is much easier here in the city because we have we have a solid enough transportation system that gets people to where they need to go. But I remember seeing, and I wonder if you have as well, this one PBS NewsHour news story segment where they looked at the differences between Atlanta, which also has a very large host as well, and that too was a major metropolitan center, but the access to treatment is much more difficult to come by because there's a lot of logistical opportunity costs and transportation related hurdles. So I'm just asking, how do you incorporate the outside within your own context as to like what could have a bearing on the outcomes that you're trying to measure?
Right, well, I go back to you and I tell you this, you write it out as your objective statement. And then you make your way through, right? I mean, that's the critical piece of this. And the objective statements are not necessarily easy to do. And what you will recognize is that you are iterating a lot until you get it, until you feel, because when you write your objective statements out and then you try it out, you'll start recognizing that you can't do it.
I see.
Right? All right. Or that you're getting a lot of noise, right? That you're just getting too much. And so, so my suggestion is make a couple copies of it, and you'll see that you get a little booklet out of it, right? And it happens really, really quickly. And again, think about it as it's a leadership tool, right? In the first slide I was showing you in leadership, right? The real issue in leadership is that communication is poor and faulty, right? So you can use this as a communication tool, right? Because you can have people affirm it. Do you agree with this? Right? And you can just double back. And again, you got that's the way I think about this, right? So this was, like I said, it was this lucky brain thing, right? That stuff popped into the brain, but and it's not really a linear thing. It's dynamic. It's just going all over the place, right? And so when you're making your way through it, you just have to recognize that that's what's going to happen, right? And by the way, so your plan could be, what I didn't put up here is that you could put a date on here, right?
Right.
But you could, put a date. You could classify this a little bit about where you are in this program implementation phase, right? If you're in the exploration installation, right? The implementation phase, wherever you are, right? So you could do it for all of these different phases.
You could flip very quickly into a Gantt chart.
Yeah, I was thinking about that.
Yeah, or a run chart.
What's your
The run chart for quality improvement, right? Shows you
yeah.
how you're making your way through the project, and then it has these annotations about things that happen, right? The guy got the new job, and life went on, right? So you get these ways to do this. I mean, we could, you could show it graphically, also. But I think it's important to understand it a little bit conceptually and just try it out. So if you guys are willing or interested, I'm happy to, spend a couple of minutes or some other time. Sean has my email address. You can email me and we can go back and forth a little bit on trying to to get something where you're comfortable.
Oh, that will be very fantastic and very relevant. I could tell you why a little bit out after.
Happy to do it. And I like to use video conferencing, so I use Zoom all the time.
Mhm.
And I have this one rule is that you have to turn the camera on,
Mhm.
you know, because what I do know about people who use video conferencing, myself included, is that if I don't turn the camera on, I'm going to be doing my email or, you know, might be eating lunch or whatever I do during those things. But, you know, it's the interpersonal communication that you get through the visual is a good way of doing it. And the other thing that happens, you know, if you're using this format, then you could type and I could see what you're typing in and we can, you know, dynamically edit things and it accelerates the process.
Other questions for Paul?
These were my questions to you, right? So we were trying to just go through those. We have a little, did you hand out those evaluation sheets? So if you guys could write down whatever you think about these things, I'd be highly appreciative about this because I believe that when I do these presentations, I need to collect data too.
Anyone? Joe,
I have.
Okay.